My name is Imran Nuri. I'm the founder and CEO of the 52 Million Project, a 501c3 nonprofit going after a long-term vision of engaging 1 million people and donating just $1 a week. When our donors give $1 a week, it goes to a different nonprofit fighting poverty every single week. And this week's beneficiary is the Charitable Pharmacy of Central Ohio, who is set to receive over $1,200 from us thanks to our 600 active donors and counting, and a matching gift from some generous donors named Mari Walsh and Beth Lenoble. With us here today is Melanie Boyd, the Development Director for the Charitable Pharmacy of Central Ohio. Welcome, Melanie.
Thank you. Well, first of all, thank to you and certainly to all of you, and especially Maury and Beth for being so generous.
Yeah, we're so excited to have you here. We're so excited to be able to give what is now our largest gift to date with $1,200. And one of my favorite parts about doing this podcast is hearing the passion and enthusiasm directly from the people who lead these nonprofits like you. And so let's get right into it. Tell me more about what the Charitable Pharmacy of Central Ohio does.
Well, I guess in a nutshell, we consider ourselves a local solution to a national crisis. So when the pharmacy opened in 2010, we recognized that we were addressing homelessness and we were starting to address food insecurity, but there hadn't been a hard look at how to get medicine to people who couldn't afford it. And that's where we came in. So we started small that first year. And since then, we have dispensed about 500,000 prescriptions, totaling about $50 million. So we're working with people directly, and they come to us, and we do two things. One, we make sure they get the medication they can't afford, often life-saving medication. And then we make sure that we're talking with them one-on-one. So it doesn't just stop handing a bag. We sit down every single time they come to visit. We go over their medication, answer any questions, identify what might be some drug-related problems that might be dangerous, and try to address those. So that's what we do. And we also coordinate healthcare. So we know when people come to our doors, medicine might not be the most critical need they have that day. It might be food, it might be housing, it might be some other emergency. So we work very closely with area organizations, and we actually have a social worker on staff. We think we're the first in the country to have done that. And she's been incredible in helping us expand our mission even further.
Yeah, what I love about that is that it really sounds like you're taking a holistic approach to this, right? Like it's not just, like you said, it's not just handing a bag and handing someone what they know they need. It's making sure that they're okay in all aspects of their life, so that it's, they're getting the life-saving medicine they need, and they're getting everything else they need to live a self-sustaining, healthy lifestyle, right?
Absolutely. And the people that come to us, we only have two requirements. So they are living at about 200% or below the poverty level, although about half of our people are at the poverty level. And they're also Franklin County residents. And we kept that really wide open so we could help as many people as possible. As you might imagine, as is the case for every other nonprofit in Central Ohio and elsewhere, the pandemic changed everything. So we look at it in terms of a couple of phases. So back in mid-March, when OSU closed to students, we looked at our population, about half of whom are 60 years or older, and all of whom have chronic health conditions, because frankly, poverty is bad for your health. And we said, you know what, if the students can't be out in the world, if they need to shelter at home, then our people need to shelter at home. So in 2 days, we completely pivoted the way we do things. So we closed the building. It's still closed for now, but we're continuing services, and we're continuing to meet the needs of everyone that comes to our door. Couple of differences. One, we're doing service, and 3, we're filling 60-day supplies as opposed to 30-day supplies. We started that really early because we wanted to make sure people could shelter at home. And in the end, last year, the number of medications that went out our door increased by 46%, and the cost of those medications went up by 86%. So it was busy, but Central Ohio, certainly 52 Million Project, and so many of you and so many of our donors were there and helped us meet the call, and we're continuing to do that.
That's amazing. We love to hear about the pivots that nonprofits have had to make and have done so successfully. We love to hear that. So tell me more about what a gift of about $1,200 from us will do for the people that you end up serving in Central Ohio.
Sure. We can make the most of every dollar that comes in for 2 main reasons. One, we have a huge core of volunteer staff. Mainly those are interns that come from the OSU College of Pharmacy. So 5 of them come to us a month. We think of it as our Pay It Forward program. During that time with us, they typically are going to talk to about 180 to 200 patients. And for some of them, that may be the first time that they've really encountered poverty face to face. So we hope that when they leave and go to a CVS or a hospital or wherever, they're more equipped to serve the needs of individuals that are struggling. But that ends up being about 400 volunteer hours a year. And then in addition to that, we receive a lot of donated medication. We can't take it from the public, obviously, for safety reasons, but from physician offices, from charitable distributors, from long-term care facilities where some medicine hasn't worked, or there was the wrong dosage, or the patient has passed away. We recycle that. And so we call that our recycling program. And some of our volunteers are literally punching pills out of pill packs and putting them into bottles so we can get them in someone's hands. So the good news is, because we're getting all that volunteer work, and because we're getting so much donated, every dollar that comes in, we essentially turn into about $8 worth of services and medication. And specifically, that money goes to pay for the medication that we don't get contributed. And specifically, the highest costs there are inhalers, and no surprise to anyone that's been following the news, insulin for our diabetic patients.
Exactly. Yeah. It was so interesting yesterday. As I was driving around, I saw at the corner of an intersection, I saw one of those typical yard signs, but instead of it advertising a small business, it had a phone number and said, "Does anybody have insulin?" And I was like, such a sad thing to see. Yeah, like anybody who's been paying even a little bit of attention has seen that it's just an unfair a surge of prices for anybody who relies on that to survive. So we're grateful that the Charitable Pharmacy of Central Ohio is here to fill that unfortunate need. So I have one last question for you. For anybody who's listening or watching at home that wants to support further, what is one of the best ways that they can help you in addition to this being part of the 52 Million Project and making this donation?
I wish I could say volunteer, but just due to the nature of needing to deal with the medication, and the biggest part of it is organizing that, we can't bring people in. And right now with the building closed, we can't really bring any volunteers in. We do need to spread the word, though. I think over the past 10 years, we've started to gain some name recognition. One of the reasons is because we're opening our second location in June in the Linden community. And we're actually going to be partnering with a fresh market. So again, we think it's the first time nationally, we haven't seen it anywhere else, where we're going to embody food as medicine and say, here's a prescription for food, here's the medication you need, and now you can go down the hallway and get some free food. But back to your question, the biggest way is, one, to help us get the word out. And certainly we do have a website out there, charitablepharmacy.org. We do take donations. And again, as I said, we can turn every $1 into 8. So yeah, I guess those would be the best.
That's an amazing thing to be able to do, right? Like for anybody listening at home that says, well, maybe I could donate another $10, you know, that it's a good feeling. It's not even selfish. I don't think it's a good feeling to know that you're donating $10 and it's turning into 80. And as that goes up, obviously it multiplies the same way in a tremendous way. And that efficiency is truly incredible. But thank you so much, Melanie. And thank you again to each and every one of our donors for empowering a different nonprofit fighting poverty every single week, just like the Charitable Pharmacy of Central Ohio. If you're not already a donor, go to 52millionproject.org and start giving your $1 a week today. But thank you again to Melanie, and thanks to the entire Charitable Pharmacy team.
Thanks. Keep changing the world.
We will.